Good evening, everybody. Welcome to another episode of Ranto Weekend. Ranto Weekend is that program specially designed to help you answer a lot of questions, help you answer many health questions, create like a safe space for you so you can just rant and tell us what's on your mind. Today's topic is quite an interesting one because I just want to focus on a lot of mental health issues and how it relates with our day-to-day activities, how it affects our long-term activities, how it helps us do our things. Today's topic is going to be depression. So it's important to get some definitions right if you want to know what depression really is. There are various definitions that have come in when people talk about depression. Depression can be a state of mind that somebody is at the moment. You say maybe something happens and you say, oh, I'm depressed. My football team lost the game. Oh, I'm depressed. Or rather, I didn't get as much marks as I thought I would get in my exam. Oh, I'm depressed. But also, depression can be a whole illness that encompasses different symptoms. So depression can be seen as just something, it's a transient thing, just like what you are feeling, a mood you are feeling. And depression can also be a whole illness. And it's important to know that depression can be lifelong. Depression can come as a result of you being exposed to some problems, maybe in the family, maybe a heartbreak. That can cause some level of depression. And then depression can also occur due to some serious disorders in the brain. Like I said, that when you have somebody who has some form of mental illness, it doesn't mean that person is actually weak. So don't mistake having a mental illness for weakness. Because some people who we think are like the strongest, are some people who we think they are the most vocal within us, they still fall to be very big patients of mental health problems. It's important to know what it is when somebody has depression. So when we say somebody has some mental health problems, what are the important things to look at? For example, now we're talking about depression now. When we say this person is depressed, what are the most important things to look out for? It's important to know that when a person gets depressed, one of the easiest things that happen to them is what we call early morning awakening. They wake up in the morning feeling gloom, feeling sad. Some people wake up as early as 3 a.m. and they can't get any more sleep. That's a problem. Also, people start losing interest in things that will normally give them pleasure. Some people who like to play, some people like to play football, some people who like to engage in some intimate activities. Just all of a sudden, they just start losing interest. And then the flip side is some depressed patients get too much sleep. So that's the spectrum. And then there's also this part of depression that when you feel that the current situation you are in is your fault. That happens too. When you feel that, there's nothing I'm doing right, everything is going wrong, then you often find depressive patients crying a lot too. So there's this feeling of sadness, extreme unexplained sadness that comes to them. Also note that some of the most depressed people of us are about the happiest people you can see. Why is that? There's a reason. Major depressive episodes. What happens in major depressive episodes is that all these symptoms are put together, they come and they go. Call it episodic. Because at some time it will come, at some time it won't be there. If one person has one depressive episode, there's a 50% chance that you will have another. And then when eventually the person has another, then the person has a worse episode. And then it keeps spiraling out of control. Until it gets to that dead end of depression, of severe depressive episode, that is suicide. So what is the next best thing to do? There are two major things: drug therapy or psychotherapy. So for the mild case of depression or the major depressive episode, first episode, second episode, yeah, they might not need drugs. Some people do very well with psychotherapy. Psychotherapy will mean just having to speak with a specialist, maybe a psychologist or a psychiatrist. Also, one very important way to deal with that mild episode of depression is exercise. Exercise is extremely important. At least getting 30 minutes of exercise daily. Because one of the major reasons for having mild depressive episodes is this chemical in the brain called serotonin. When serotonin is not properly produced in the brain, the person can now be slipping into depression. So you have to give them drugs to now help them increase serotonin. But believe that if you do a lot of exercises can help the body produce these hormones properly. And then also having some form of diet. It's a diet called the Mediterranean diet. It consists of a lot of fish. You want to do exercises and then you just cut off sugar. For the type of depression that will need medication, those are the severe types. It's important to note that when people start taking antidepressants, they might need to take it for life. It's also important to know that people who will notice that have mild depressive episode, it's important to help them out. Sometimes just asking questions about how are you doing, how's your day going, how's your family, do you have money? So depressive episodes is quite important to get to, especially get to know when these people are having some form of problems. One of the things I also say is depression is not just psychological. There's a psychological part of it, but there's also an anatomical part to it. Like some people's brain are designed in a way that they do not have enough serotonin. You get, so some people's brain is designed that they will be depressed. It's important to know that if you feel something, at the point where you feel that you are not as happy as you are, at the point where you know that things that you're not getting along with life as you ought to, at that point, that is the most important time to speak up. Subscribe to my YouTube channel. Go get it, guys.